get to you so that we can have a round of introduction. So thank you so much for joining our webinar today. We are here with a team of fellow peers, champions who are advancing reproductive health in our community. So I'd want to appreciate all the speakers who have agreed to join us today. And at this point in time, we'll take this opportunity to introduce ourselves, who we are, the organization that we represent, and our designation where applicable, and our expectation for this session. So I will start with Ms. Joanne Chanya. Please introduce yourself.
Hello, I believe you can hear me.
Yes, we can hear you.
Okay, Miss Joanne Chanya. I am a founder of the Big Sister Initiative. So far, it's in Taita Taveta County. What was the other question?
What is your expectation today?
Okay. I believe this.
So what are you expecting?
Okay. Can't hear you.
Yeah, just proceed.
Okay. I believe this webinar will set precedents to covering more ground on achieving more information, getting more information down to the rural areas and the villages on matters ASRHR. So this is one of the ways we can continue to collaborate and ensure all stakeholders come on board to make sure information gets through in achieving zero teenage pregnancies. Yeah.
Thank you so much, Miss Joanne. I'll invite Maureen to introduce herself. Karibu, Maureen.
Asante sana Noli, and very big greetings to everyone that is watching and listening now. My name is Maureen Magag. I am the founder and executive director for an organization is Pan-African and is called Lend a Voice Africa. We are located at Kembeni, operating Mombasa County, within Kisauni sub-county as well. So at Lend a Voice Africa, we champion matters social and gender justice. We champion matters sexual reproductive health and rights access. We also champion matters mental health, among other programs that we mainstream within these program areas. Now, this conversation is very important and core to what we deal with. Is a timely conversation, being that, again, the world is being digitized, and just to lock heads together and see the avenues in which we can grab opportunities on how to digitize the access of SRH in terms of, again, reaching adolescent girls, and of course, again, with reference to ending teenage pregnancy. So I'm looking forward to, hear those trends, hear those, the new age ways in which girls are accessing this SRH information. I'm looking forward to how we talk about even the AI tools in how they are used to even advance the access to SRH and with regards to ending teenage pregnancy. So thank you so much. Stay locked in.
Thank you so much, Maureen, for the introduction. I will welcome Mercy Mugecha to introduce herself. Karibu, Mercy.
You. My name is Mercy Mugesha. I am a youth advocate at Productive Health Network Kenya. I am a champion for sexual reproductive health and rights. I'm also a student at the Kenyatta University. I mostly advocate for adolescents and young people to access SRHR services, and mostly in the informal settlements or the underserved areas in Nairobi, like Korogosho, Mathare, Kibera, or the informal settlements. I'm so happy to be part of this webinar discussion so that I can be able to represent other adolescents and young people, voice out the challenges that we are facing at a grassroots level. So I look forward to learning and also unlearning from all of us, and also represent the adolescents and the youth in SRHR. Thank you.
Thank you so much, Mercy Mugecha, for that introduction, and we hope we are going to learn together. And at this point in time, I'd like to welcome Sindoli Esnas. I believe I pronounced it well. Sindoli, you are welcome to introduce yourself.
Yes, nice to meet you. So my name is Indoli Rasna. I'm a youth advocate for the 34 Middle Youth Africa. I'm also invited to the last year, and I'm looking forward to spreading my knowledge on ASRHR and also share my knowledge and practices on ASRHR also.
Thank you so much for that introduction, and you are very much welcome to this session. And last but not least, I'll welcome Winchester to introduce herself. Karibu, Winchester.
Thank you so much. Okay, my name is Winchester Valerie, and I'm glad to be here. I am a communication person and also the youth lead at a community-based organization called Nkokoiju Africa. Nkokoiju Africa is a community-based organization that champions for the rights of young female sex workers and sexual minorities in Mombasa and basically Kisauni and Nyali sub-counties. We do advocacy, capacity building, and also empowerment. And in today's discussion, I am glad to be in this studio to also unveil the existing gaps and also looking at the opportunities in them, in that we are unlearning the common beliefs that concerning the adolescents and the teenage pregnancy. Thank you so much.
Thank you so much. And of course, my co-host is here with us. We had some small technical challenges, but we will give her an opportunity. She'll be taking us from the 6th question moving forward. So Martina, please take the floor and introduce yourself.
Good evening. I'm Martina Adjamba. I'm representing COVID. I'm a mentor and facilitator for sexual reproductive health for young girls and adolescents. Welcome everyone for this session.
Thank you so much, Martina, for that wonderful introduction. And we'll go right to our first matter, which what is our take on facilitating ASRHR, adolescent sexual reproductive health and right information through digital means? Is it a good way? Is it a bad way? Is it yielding positive results? And at this point in time, I'll invite Winchester to unpack for us what is your take on facilitating adolescent sexual reproductive health and right information through digital means, because you have indicated to us that you are a digital person, I'm a communications person. Winchester, karibu.
Thank you so much. Okay, when you are looking at facilitating SRHR information through digital means, we are basically looking at it from this aspect that is it is a powerful approach to reaching young people, particularly in the today's tech-driven world. So when we are looking at these young adolescents, because ASRHR is adolescents sexual reproductive health and rights information. So we are looking at it from the aspect of accessibility. By looking at accessibility, when we have these digital platforms, because it is being broken down to mobile apps, social media, and even websites. So we are looking at it at breaking the geographical barriers and even providing crucial information for those who can't even access healthcare at those facilities and even the clinics. And secondly, we are also looking at the anonymity aspect, because young people have this notion that they want their information to be private. So they want to look at a platform that they can share their information, and also there is no fear of judgment when looking at it. And thirdly, I can also say that by involving SRHR in digital platforms, we can see that there is engagements and even interactability, because there is that interaction whereby there is no fear, you can just speak your mind. And also we are looking at it from the aspect of the quizzes, the videos, the forums, because this content can actually be very tailor-made for each and every young person or adolescent in Kenya as a whole. And also I'll say that, however, that there is the advantageous part of it, but also looking at it, there is the other part of it, whereby it can be it can come as a challenge, whereby we can see that there is digital literacy and access. There are those young people and adolescents who can't even access a smartphone. So when we are looking at the dissemination of this information, we also have to consider those in the remote areas, the underserved areas. How are they receiving this information? Yes, do they even have the resources to actually access this information? Yes, we have the information on websites, on mobile apps, but are they accessible? And also we are looking at the misinformation, whereby internet can also serve as a breeding ground for misinformation. So we have to look at it from the aspect that there is provision of accurate and evidence-based information, and these sources should be actually trustworthy. And lastly, I can say that in summary, digital platforms offer a unique opportunity to broaden the reach of SRHR education and services, but they must be implemented thoroughly, thoughtfully, and also with attention to access, privacy, accuracy, and inclusivity. Thank you so much.
Thank you so much, Winchester, for unpacking. And I'd want to invite Mercy, still on the same. What is your take? What is your take, Mercy, on facilitating adolescent sexual reproductive health and right information through digital means? Through digital means. Mercy, if you can hear me, you can take up the floor. You've muted yourself again, Mercy.
Sorry, can you hear me?
Yes, we can hear you. You can proceed now.
Thank you. Well, my take on facilitating ASRHR through digital means, speaking as a young person that is very conversant with technology, and this is where we get all our information from. Digital means we get to get, or it gets to serve a wider reach of people. Uh, it gets to help more young people, because there's where more young people are. And also, when Kester mentioned something on young people, it's a notion that they need it to be private. Well, it's not a notion. Everybody information or sexual related information or they're seeking, it must be kept private. I'll be very comfortable as a young person seeking for services online where there's no judgment, and like when I walk into a facility, it's more comfortable when I seek services online, because it is more open and honest. Like I'll be more open to speak to someone that I personally don't know. So I like how this digital technology is offering privacy, and also it is catering for wider or a wider range, and also it's also accessible. It can be accessed at any time, allowing people to seek information when they are comfortable. So
You've muted yourself, Mercy.
so it also gets to educate, like when the digital literacy, or where the young people get information, is not it's not worked on well. Like I feel it can also be unsafe when the internet use is not well managed, because there is where we also get the myths and misconception around SRHR. So it's actually nice and it's very educative. It's getting to serve the young people in very large ways, and also offering the privacy that we deserve. Thank you.
Thank you so much, Mercy, for that brief. And also, I'd want to bring Tsindoli to also share what is your take on facilitating adolescent sexual reproductive health and right information through digital means. Sindoli, welcome.
Okay. For me, I'll agree with both of them.
We've lost you, Sindoli.
You can hear me now.
Yes, I can hear you now. You can proceed.
Okay. I was saying SRHR.
Oh, we're losing you, Sindoli. Oh, are you there, Sindoli? I think Sindoli might be experiencing some challenge. So we'll get to hear from Maureen. I think there might be technological challenges on the side. Maureen, maybe if you can hear me, you can pick it up. What is your take on facilitating ASRHR information through digital means? Maureen.
Thank you so much, Nolly, for the question. I think the first two speakers have done a lot of justice in just airing what is it is all involving, and wow, many people are facing technological challenge here. So again, this is not abnormal at all. So if you're listening, do not move an inch, just stay locked, stay with us. So facilitating adolescent sexual reproductive health using technological means or digital means, I think it's the new age trend that every actors, service providers need to strive hard to adopt, and even the CSOs responding on matters ASRH, because again, we've seen how effective provision of interactive platforms are that engage these young people, and we have even seen information shared using videos. Now we have infographics. Now we have even, apps that can be used to really help these young people, get information that they really require. We have seen interactive forums that are online webinars that provide information. And look at this. These are some really working developments that wouldn't have been achieved much if it were not to, by the use of digital tools. Now you see that as much as we have this, the old ways of doing things that we still do, the physical ones, we achieve much more faster when we use digital tools because there's immediate access of information. Now, the only disconnect will be, does this adolescent and young person have access to smartphone, because it requires smartphone, and I think you can tackle that later. And of course, as long as they have a smartphone, then they can really achieve. So maybe we can not overlook that the digital is not really working for everyone, but again, as mentioned by my predecessor, it is really working. And of course, it is through digital means, we are even able to address certain cultural factors. And the more it is shared, the more people get to agree, rather than when it is physical and we share to one group of people, then it takes ages to reach. So only while you're away, I was agreeing to my predecessors that it works because, again, through this sharing, the effectiveness, you actually see it because when we share what we do, when we share the responses, when we share best practices on ASRH, digital ASRH facilitation, we actually attract even partnership. People are like-minded. Therefore, we actually borrow good practices from each other. And of course, with all the data privacy issues that has to come, then we also borrow how can we best protect. And again, we attract much more of young people's involvement when we are engaging digital matters in terms of response and access. Therefore, yes, in a nutshell, it is working. Much more still needs to be done, but it works. Thank you, Noli.
Thank you so much. And maybe before you leave, I want you to introduce us to the second question. And we're looking at what are some of the advantages or disadvantages that digital ASRHR information have over in-person facilitation over the same. What is the advantages and disadvantages of the digital means of facilitating the information as opposed to the in-person, the one that you have to go physically and meet with, say, your service provider or your peer educator or your champion? Maureen.
Thank you, dear. Thank you so much, Noli. I think one of the biggest advantage that we cannot dispute is the ability for it to have a wider reach. And that is because, even as you can see, we are doing this webinar now, but every young person that is listening already has access. They don't have to wait for any special physical sitting to get the information. Therefore, the reach is instant. Now, again, we have a lot of, again, privacy and anonymity in some of the digital access provided that provide this anonymity. I know a few that I'll mention. So you find that a young person is really comfortable sharing their fears, sharing their information, requiring, maybe seeking help, because they know that they are protected. They know the person behind is listening. The person behind is really a sensitive person that is not going to, that does not know them and is not going to either share their information. And again, evidently, it is highly cost effective, depending on, again, the mode of digital access you are referring to. So as opposed to in person, for example, right now we are sharing this information, and if we get adolescent and young people and want to share ASRHR information, then we just have to gather, do an invite. We have to organize a webinar like this. We have to share. Now, in terms of sharing, the information is cost effective. Again, on digital platforms that we have and even social media, you just have to really develop really good information that you want to pass to these young people, share it, and by good luck, it goes viral, and instantly every adolescent and young person in the world who can access digital platforms accesses it. So look at it, how powerful it is. You see, we are here in Kenya, but a message that requires ASRH intervention is going to reach even America in the next even 2 hours. So that means that we didn't have to spend a lot. We just invested in a digital platform. And again, let's talk about availability and even continuity. You see, digital platform have this habit of retaining information. Therefore, it is good information shared towards access to the adolescent sexual reproductive health rights information, then it stays there. Every single time a young person wants to refer to, this really good advice they had, they just have to remember what was the title. Okay, they just have to remember which media or social media did I see it in. They just have to remember, did I retweet it, did I repost it, did I reshare it? So let me go to this timeline and watch it. Therefore, you find that it is retained and the information is there, is lively there, and lives longer, lives longer than even the problem itself, because then the problem gets solved by that information just being there and a person getting information, following up, a person being guided. And again, let's not forget that young people love to interact. Young people are interactive people, are very social people, and therefore, these digital tools provide an interactive space that engages these young people. And in some digital spaces that provide SRHR access, you find that you even get instant chats. Yes, you find instant chat the moment you send a prompt, and you get somebody at the back end, be it a chatbot, just asking questions. You're there, somebody's there for you. So you're engaging with someone, your anonymity is kept, and also you have your personal issues that you can even share without feeling judged. So I mean, it's just powerful for it to be that way. So let us keep embracing the use of digital tools for advancing ASRHR. Back to you, Noli. You are muted.
That's why I prefer putting my microphone on. So I'll bring Joanne, and Joanne, I'd want to know, one, as you are sharing with us the advantages and disadvantages of digital ASRHR information provision as opposed to in person. Briefly, we can get your feeling, even as a provider or as somebody who works with young people. What are some of the advantages and disadvantages of providing this information virtually as opposed to in person? Joanne, karibu.
Thank you, Noli, for the question. In my in my initiative, I had a session. Let me give an example. I had a session on social media use with young youths in my community, and I was just trying to listen to what they're saying about social media. And now in the wake of TikTok, in the wake of Instagram and Facebook, which are easily available to them, and they're found in phones, and how the network is easily available nowadays in the rural areas also. So everyone is accessing the TikTok and everything. So I just posed a question to these young people on what they feel is a disadvantage to them, and they all say that it was how easily to access such information online, mostly now on reproductive health. There are videos which they can share, which they keep seeing, and some are positive and some are negative, and it just showed how easily they can be impacted on the same. So I would like to, as the previous speaker has said, it covers a wider range of people, of youths, yeah, and then it's cost effective. You don't have to plan for an outreach to go and talk to them about the same. So once they are in the social media, you can just use it as a way to educate them. Now you can have WhatsApp calls. You can just join in, which they also have. So it's a good channel if used properly, and then it's also a bad channel if people can access. These sites are easily available. These negative sites that showcase how can I put it? There are so many sites, bad sites, which can easily watch. So it's regardless of being a very good channel of information, we still have the need to monitor these channels, in a digital system. So that's my take.
You're still muted, Nolly.
Sorry about that. So, Winchester, maybe to take us through in this advent of cybercrime and computer misuse, including cyberbullying, how do we make sure that our adolescent and young people are protected and safe online? Or for those adolescent and young people who are accessing information online, how can they keep themselves safe away from bullying in the advent of cybercrime and computer misuse? Winchester.
Thank you, Nolly. In the advent of adolescent and young people, in looking at it from the aspect of safeguarding their rights when they come online, okay, I can look at this from the aspect of it is important to adopt a comprehensive, multi-layered approach that combines education, technology, policy, and community involvement. Okay, to expound on this, because the young and adolescent people, most of them are actually in schools, and others they are back in the community. So when we are bringing this information that we are sharing online, I feel like we should come up with platforms that are actually addressing the needs of both those in school and even in communities. And also when we are sharing this information, the community members should also be included in such situations, such as mental health awareness and support. We can see that there are so many young people and adolescents that are falling victims of cyberbullying, and even they fall as victims. So looking at it, we should find ways to support them when it comes to cyberbullying, whereby we can also have these counselors online, because I can see, okay, at the moment, for example, the organization I work with, we partner with a partner called TICO Triggerize. There is the online platform whereby they can share information when it comes to ASRHR. So I feel like such platforms, they are very useful, but also there is the downside. So when all these partners and all these people in the communities come together and they come in, those with technology, the education part, and also looking at the community, even the gatekeepers being involved, I feel like we'll tackle wherever is happening. And just to make these digital platforms more effective, I feel like they should be peer-led and also youth-led, because when it comes to from a point of relevance, because I am a youth and I'm speaking to you as a youth, I feel like my fellow youths will just pick it up so easily, other than someone else coming in, maybe someone who is 30, 40 years coming to tell you something. You're like, no, you don't even relate to my struggles. But when a youth and a peer comes, and there is that education, peer-led education and youth-led education, I feel like we will be somewhere. And also, I'll say that to protect these AYPs, the adolescent and young people, from cybercrime and misuse, a combination of education, as I mentioned earlier, technological solutions, policy enforcement, and community support is very critical. Empowering these people through the right tools and knowledge, while ensuring that there is engagement, and also the platforms are very secure and ethical, there will be a safer online environment. Thank you so much.
So I can see Noli is not around, but in his absence,
I am here. I
yeah,
am
he's
here.
going
I
to
am here.
be okay.
I am here. I was just confirming if you can hear me. And I wanted to bring on board Sindoli, or still on the same. How do we protect and make our adolescent and young people safe online? Now that we have cybercrime and computer misuse. Sindoli, how do you make sure that your young people are safe when accessing these digital information and and the services? Sindoli.
Yes, okay, I think with the use of cybercrime and misuse of personal information online that has been mostly rampant nowadays, ensuring safety of adolescents and teens is very, very important. Where one of the steps you can talk about is establishing clear online safety protocols. Maybe if like for teenagers, we can have maybe part.
Sindoli, have I lost you? We probably have lost Sindoli. I'll give this to Mercy to share how you make you make sure that the adolescent and young people are safe online in this time and era when we have cybercrime and computer misuse. Mercy.
Thank you for the question. I think one of the most effective ways that we can make sure that our adolescents and young people are safe from the cyber crimes, and not only the cyber crimes, but also the misinformation that circulates around along SRHR, we should increase our teaching, or we should sensitize our adolescents or AYPs more. For example, let me use the recent trend that went viral on TikTok on some girls on the recent challenge on chorea, teenage pregnancy is not a crime and all those misinformation that were going around. I think we should really work on how we handle adolescents and young people, how we educate them, how we make CSC very conversant or very accessible to them, because you might find that if an if a young person or maybe an adolescent is not being affected by maybe cyberbullying, they are on the side of misinformation. So we should really strengthen our education and also online. And I like how our previous speaker said that we should use the peer-to-peer method of educating our fellow adolescents, because personally also I'll be more comfortable if I'm talking to my a person my age who is very young and
Mercy, we seem to have lost you. Oh, we seem to have lost Mercy. Possibly it might be something technological or to do with connectivity, but we'll have to proceed. So as we go to the fifth question, I'd want to find out from all of us, what could be some of the contributors to teenage pregnancy, and I'd like to hear from all of us as I hand over the second session to my co-host, Martina. So we'll go from Maureen, and then we hear from Sindoli, then with Chester, then Joanne. What are some of the leading contributors of teenage pregnancy? Maureen, Sindoli, then
I,
Winchester, and then Joanne. Karibu, Maureen.
thank you so much. Um, One, I would say, sadly, lack of comprehensive sexuality education that we have pushed for the longest time to be implemented in Kenya, especially inside the education curriculum. And it is sad that the understanding of this sentence loosely just means teaching about sex in schools. So again, the decision makers have failed the adolescent and young people terribly by closing their eyes and feigning ignorance on the very thing that they need to do to bring a solution. Because how do you expect a young person who is not informed from a younger age to really catch up and know about their responsibility when it comes to their sexuality, their responsibility in awareness, and even building self-confidence in terms of, again, who they are in their sexuality. Therefore, lack of it is detrimental. And of course, I know in Kenya we have a hot discussion on matters contraceptive in adolescents and young people. But again, let me put it in terms of young people again, where there are some 18, 19 who are at the age of consenting. We cannot feign ignorance that they're not having sex. Okay, we all are aware that in Kenya the sex debut age is as early as 8 years old, and ignorance is a bad thing. Therefore, limited access to contraceptive awareness to consenting age from the age of 18 and 19 is something that is also bringing the society down in matters, again, the early pregnancy and teenage pregnancy. And again, let us look at issues of peer pressure. That is also, as my predecessors talked about, we are seeing it greatly growing currently under that a misinformative wave of chorea that is mobilizing young adolescent girls and young people, just motivating them to get pregnant, and it to look like being pregnant is something so cool. Therefore, we do advocacy 10 steps, and misinformation like this, coupled by, pressured by the peer influence, also really bring us down. And therefore, I think, again, we are in the right platform talking about it and calling them out so that we see the strengthened structures on how digital tools can be used positively in influencing change and ending teenage pregnancy. And again, Nelly, let us talk about matters cultural religious beliefs, where we know of some cultures that marry off their girls really at an early age. Okay, so one of it would be, in terms of, again, early marriage being used as a cultural, right, sort of, for these girls. So, just an example, a girl I know from a tribe I cannot mention, at the age of 12, was married off to a 60-year-old. Now she is 22 and having 4 babies. Now this girl fell pregnant at least at 13. Now you see, she fell pregnant because culturally she needs to get married at 12 Now look at this, how injustice, how traumatizing, how stigmatizing even our society in that culture, put girls through. And again, Anoli, the weak gender equality structures that has been put really imbalances these powers, rendering these young girls like they have no say. They have to do whatever they have been told because they are girls, because again they have not been empowered much with the voice to even say no. And of course, one of the worst avenues of teenage pregnancies has been through sexual violence and even coercion that our community is struggling with, especially where we are now. And you see the aftermath of sexual violence is mostly the pregnancy, and this young girl is left with the pregnancy. They cannot even track, and they cannot even say aloud who is it that made them pregnant, because again, when you're violated sexually, then it is deemed something that is very shameful to talk about. So this girl ends up carrying all this burden alone. So if she is even at the age of 12, you give birth, and the same stigmatization, the same mental health condition, the same feeling like you are worth nothing, still rolls this person to the hands of pretentious people that will say, I got you. Yeah, I will accept you the way you are. Then they end up again being impregnated. So it becomes like a serial something in the hands of people they trust the most. And of course, to say some list again, the media influence and matters sexualization. We all see, being in Kenya and being in East Africa, my fellow speakers, we all see how sexualization has been used to even increase the even urge of having sex itself. And of course, this sexualization matters, they do not actually come with a message for you to even protect, for you to even be aware that there are STDs or STIs out there. So with the media influence, which is accessible, and of course we don't have any gagging in terms of what is shared for real, then we see sexualization issues in songs. We see sexualizations being portrayed, be it dances, like right now, and again they say sex sells. So you find that again, the moderation, and it gets everyone. We see sexualization issues even in matatues, in words. So again, this promotes in a high level matters teenage pregnancy, and one that the community is struggling with as I end is something I can call intergenerational patterns, or something heredited within the community. You see, there are these families where if a girl, probably a firstborn in the family with a girl, got pregnant at an early age, then there's likelihood that the other teenage girls, they also get pregnant. It's like something that is following the family because the awareness is not done, and victimization is thrown to this girl that got pregnant first. And again, there's a lot of lack of clear communication. Okay, now this comes where a mother says, wewe enda tu upate mimba. So this is influenced by family, influenced by how the parent communicate, lack of clear communication. A parent can say, you shouldn't get pregnant this early. These are the things that if you do, you'll be pregnant. You're providing information, but what do our African parents say? Wenda tu upate mimba, loosely translated, you just go and get pregnant. You see, this is a direct order. So for a child who does not want to disobey the parents, they'll always remember, my parents say, just go and get pregnant. So I leave it at that so that my fellow speakers can also add something. Thank you for now.
Thank you so much, Maureen. We can hear next, maybe the causes of teenage pregnancy. Please, let's make them brief because I can see time is not on our side. Who was to be next after Maureen?
Okay, it was me.
You can proceed.
Yeah. The contributions to teenage pregnancy, as Maureen has just said, is lack of access to accurate SRHR information, whereby hiyo inaweza changiwa with parents or friends, like the example she has just used of where a parent tells you, I will use another one where usiwahi lala na kijana. So the information there is not accurate. You see, another thing I'll say is cultural and religious barriers to contraception use, whereby we have some religions, that prohibit or bring barriers to contraception use, whereby they ought not to use them. So
Cindy, we can't hear you. And we can see
another
Lori has
one,
gone.
another one I can say is peer pressure, whereby peer pressure can be caused by romantic relationships which the teenage girls are in, or peer pressure from friends just to conform to social norms within their friends group or the environments they are in, which maybe might be supporting sexual activities, where you can get some places where sexual activities is very normalized. So for this teenage person, for them to maybe be seen as people or be identified, they'll have not to engage into early sex. Another one I can talk about is social economic factors, e.g., poverty, whereby girls can engage in transactional sex to be pressured maybe into early marriages, so that maybe a dowry can be paid as a livelihood for the family to survive or for the girl to survive financially. Another one maybe I can add, it's limited career opportunities, whereby in some maybe religion or cultural realities, or young girls and teenage girls are uh, have barriers into educating further, then they have no option than seeing motherhood as the only option. So those are my contribution to early teenage pregnancies.
Thank you so much, Cindy. We can get to hear from another speaker on what are some of the leading contributors to teenage pregnancy. Mercy, you are coming next. You're on mute again.
On the same, on the challenges that really contribute to the rise on teenage pregnancies, we lack youth-friendly healthcare services in our local places. And also, when you find maybe there's maybe one or of these youth-friendly services, they're not tailored to cater for adolescents and young people's need. These spaces have no maybe commodities of contraceptives. The people that are there are old people, so young people are not motivated to even go and express themselves there. So it's also a challenge, and it's something the government should really embrace and work on setting up these the places, and also making sure that the places has the necessary things. In addition to another factor that really contributes to teenage pregnancy is substance abuse. While a lot of young people are into drugs, into alcohol, and they'll go to those parties, and at that time they'll engage in sex, in unprotected sex. Well, they're not okay, like their judgment is impaired, contributing to other cases of also contracting STIs, HIV, and also teenage pregnancies. We also need to work on the media influence. As I said earlier, there's a lot of information circulating in TikTok, Instagram, and all over place on how it is not dangerous to get a baby when you're young and all that. And I also want to appreciate all the speakers that have talked about the limited access to contraceptives, and also CSE. Well, CSE, comprehensive sexuality education, is not yet there in our facilities. And as the first speaker said, people have that notion on, if it's CSE being taught in school, we're going to learn about sex, we're going to be taught about on how maybe to engage in sex, and they forget that CSE does not only cover that. Does not even have that. It teaches adolescents on even to understand their bodies. If it's girls, they learn about their menstrual cycles, the hygiene, how to know if something is okay, and if it's not, the channels that think that also another factor that really contributes to the high numbers of teenage pregnancies. Thank you.
Thank you so much. I can see time is not on our side, but Winchester had something to add. Please, briefly, less than 30 seconds. Winchester?
Thank you so much, Noli. I also would like to shed some light on the socioeconomic part, because when we are looking at it, we also need to look at it from the aspect of the child-headed families, whereby this child who is an adolescent or a young person is the one who is supposed to go and look for the needs of the family and come back home. So we can see that these young people go out there and they're between the age of even 15, as early as 15 to 24, they become young female sex workers, and in the process they'll get pregnant. And we are also looking at the triple threat, whereby there are other things that we can contract from sex. When we look at it, because this young person doesn't have choices for protected sex, because the socioeconomic factors back home, they can't even allow them to have the negotiating power. So they'll go out there, they will have unprotected sex, and at the end of the day, this young child is becoming pregnant, and also she's bringing up another child into the world, whereby the siblings are also dependent on them, and the family is also dependent on them. And also we are seeing those families where the parents are the ones actually sending their young girls to go look and strive for the needs of the family. Thank you so much.
Thank you so much, Winchester. At this point in time, you will allow me to allow my co-host Martina to pick it from there, take us through the second bit of from the sixth question to the last. So I'd want to say thank you all. I'll be back when we'll be closing. So Martina, you can take it over from here. Karim.
Thank you so much, Nolly. Hello, everyone. Now we can move to the next question, that is question 6. Is our current health workforce prepared for digitalization of health services, including provision of adolescents' sexual reproductive health and rights information? Hello, can you hear me?
Yes, we can hear you. We are just keen on who exactly is the question directed at. Thank you.
Okay. Can we start with Joanne? Can see Joanne.
Yes, I'm here. Thank you, Martina, for the question. So I'd like to answer this question based off where I'm coming from, my county, Taveta County. Uh, we
Yeah.
still have challenges on infrastructure, which means mostly on matters network, internet, electricity, and these are the core factors that help in this digital access of information on SRHR. Yeah? So I still feel with these issues pending on like infrastructure, we still have a kind of a long way to go to clearly say that we can use digital ways to reach information to our youth. Another way I think that our health system has not already it has to work on the training and capacity building on the digital information. You see, many health workers, if I can use the same example of my county, we still have not achieved ourselves as health workers have not had training, and these trainings have to be like after like few months. We need to be trained more and more on more digital ways. And now there is AI, there's ChatGPT. So we as health workers also need to continue being trained and capacity building on and achieve more on digital systems so that we can help our youth get information. Another way that we feel we are lacking is resource allocation. In my county, back to my county again, I've been championing for information on SRHR, but if I call on board my county public health officers who run these programs in their allocation, their budget allocation, if I do a letter of an outreach or a program, they always have to be that issue of, are you going to pay us per DMs, you know? So we still have a long way. If we had more resource allocation to our counties on funding such digital outreaches on information on teenage pregnancy, I feel we can achieve more numbers and help access digital information. Yes, thank you. Over to you, Martina. We can't hear you, Martina. Unmute.
Thank you so much. Next, let's Winesta Valerie.
Thank you,
Can you
Martina.
hear me, Winesta?
It's Winchester. Thank you. I can hear you, Martina. Okay, on matters to do with, are we really prepared for digitization? I feel like my predecessor has said a lot, and I can look at this question from the angle of, we can see there is an opportunity and also an opportunity for progress. So when you're looking at it, we can also say that there is the chance of telemedicine growth, whereby we can have virtual consultations for these young and adolescent people to have access to the information. And also we can look at online training programs whereby the efforts to upskill the workforce, because yes, there are the existing platforms, but the digitization of it, yes, it has been digitalized, and the platforms are existing, but the workforce now, so we have to train them, the online training, because as I mentioned earlier, these platforms should actually be youth-centric, youth-led, and even peer-led. So when they are peer-led, these people are actually speaking from a point of relevance. We are not just speaking from the theory part, because I'm a youth, I've lived this life, I have my peers, I have my friends who have actually experienced some challenges and things that the youth face. So when we are centering it on the youth and the peers, I feel like we can really uphold this digitalization of adolescent sexual reproductive health and rights. Thank you so much.
Thank you, Valerie. Let's hear from Sindoli. It's Sindoli or Sindoli?
Yeah, it's Tindole. So
Thank you.
for me, I would say much has been said by the two speakers, whereby our health workforce is increasingly embracing digitalization, which is good, but there is still a gap in digital literacy among healthcare workers. I will use an example of our own CHVs, which are in our own counties. Uh, where I will say training these CHVs to use these tools effectively can help bridge the gap between formal health systems and the community they serve, whereby they come to the community and deal with the mostly youths, of which if they are much informed on how to use these tools, it will be a very big plus to us. Another one is attitude towards digital health. I think maybe the workers should be willing to adapt and be very flexible, because we know, or we see the advantages of use of digitalization, and which is increasing efficiency, having a wider outreach, and better patient outcomes. That's my contribution.
Okay, thank you so much, Sindoli. Maureen, add something.
Yes, definitely. If you can hear me, gladly, much has been said, but I just
Yeah.
wanted to add and pick it from where Cindy said. You see, in Mombasa County, at the community level, we depend so much on CHPs, community health providers. And when you look at their composition, you find that a very small percentage comprise of youth, and the majority, which are not young people, a very small percentage as well, um, can really operate the digital tool they have. Most of them have smartphones, but can really operate. I will tell you for a fact, I was engaged in this project, and they were really struggling. And with people like this, who you depend on them to facilitate digital access or digital information to serve the majority, if they cannot access, then what are you saying? Then it means that yes, they're good for the job, yes, you are ready for technology and digital use in health, but the workforce need to be trained and trained until they get it right, because they have knowledge, they have information, but operating the knowledge to ensure that it reaches everyone, that they are effective, they are competitive enough to serve the people, uh, is required. Now, having said this, we have also seen in for example, in the hospitals, especially public hospitals. So when it comes to the health workforce, we refer much more to the public health institutions, because that is where I base most of my work at. You find that they have a system, okay, for example, a computer, and you go for a service, and then you get to be told that they have no Wi-Fi. Therefore, if it is the information that has to be stored or accessed from the Wi-Fi, if they need the connectivity to process this information, then you're going to miss this service. I've seen it, a place where patients miss a lot of service due to no Wi-Fi to access NHIF. And then these are sad moments in today's Kenya, where people are so much, updated, and things need to run at par with the changes we are. And we've seen much more of even procurement of health machines, and when they hit the health institution, you're told there's no technological know-how, there's no like a technician who can operate it. Then we wonder who was even spearheading the procurement itself. How did it even get procured if it cannot be operated by anybody at that place? And if this particular machine is to respond to ASRH matters, then you know we are losing. So the answer is in tools. Yes, we are ready, and more is supposed to be done to onboard people to the digital readiness, to the digital practice that you want to be. And yes, we are ready is because the digital tools is already with us here. And no, we are not ready is because, again, the mind shift, the attitude, the proactivity, the uptake of this digital is still low. So thank you so much, Martina. I can't see Martina, but if you are there among my fellow speakers and you have something to add, please add. By the time Martina comes in.
Yes, possibly we can proceed. Anyone can add into the match that Maureen has provided.
Well, allow me to add something maybe before she comes back.
Please
Well,
proceed, ma'am.
on the same, on what the government and also maybe non-governmental organization are doing, maybe to promote digital access on ASRHR, there's also the use of chatbots. In Reproductive Health Network Kenya, RHNK, we have a chatbot called Nena na Binti. Well, Nena na Binti is a chatbot like that you can access online, and also we also have free toll lines that you can call without credit, and one is able to ask SRHR questions. Either you want clarity on something, or maybe you want to get SRHR services. We have youth friendly where people are referred to, and also we have partners and doctors all over the country that if maybe a person is in a very marginalized place and can't maybe access maybe a hospital maybe to go get their their services, we have a connection of healthcare providers, the community health promoters that they are referred to, and they're able to get access to any kind of SRHR services they want. So also we have other various chatbots that are promoting access to SRHR all over the country, which is a very good innovation. There's that speaker that also mentioned about telemedicine. I also want to add on the mHealth app that are there, that you can even get a doctor at the convenience of your working place. If you're at home, you're able to get a doctor online through these apps. It's a very big success to the digital world in healthcare, and also the government, their policies that are there to promote e-health. For example, we do have the Kenya e-health policy that was formulated in 2016 to 2030. So this app promotes the use of digital health solution to improve healthcare. And if it's healthcare, that also means that reproductive healthcare or sexual reproductive healthcare is also covered. So I also feel that the government is also doing something on their part to promote the access of this. Back to you, Martina.
Okay, thank you so much. Now we can move to the next session. What are some the digital adolescent sexual reproductive health and rights platform that you are working with, and what are their unique features? The platform, digital platform you're working with. Hey, let me start with Maureen.
Maureen Magak or Maureen Vigendi?
Maureen
Oh,
Magak. I can
myself.
see you only. I can see
Okay.
the other Maureen. Yeah.
She is here. She is Miss Vigendi for you.
Okay.
Okay. Thank you, Martina. Thank you, Martina. I have worked with digital platform called what is it called? Auntie Jane, and Auntie Jane's is a really impactful digital platform for the young people to access ASRHR. And again, I can say their unique feature is accessibility easily, because it has toll-free numbers that a young person can just call and gets like somebody at the back end to listen to them, to interact with them. And apart from that toll-free number, they actually have a direct number which you can get to interact with them on WhatsApp. And of course, that really fits in very well with the young people, because they like a lot of, the WhatsApp reach, probably apart from the chatting. So it is actually diverse in whatever the person wants. So antigen also is online. If you check on the social media pages, you find it on Facebook, you find it on Insta, you find it on X. And that means that if you like the page, if you follow the page, you have a choice to really go to their inbox and ask what you want, present your needs in terms of ASRHR. And also, uniquely enough, they share those information, and they give chance for the young people to challenge themselves with information and share. In also in the website, they also give a lot of downloadable materials in terms of pamphlets that young people can really work around. So thank you so much. Which one else have I interacted with? For now, I'll let the other speaker add.
Okay, Miss Vigendi. Can you hear me, Miss Vigendi?
Good evening, everyone.
Good evening.
Unfortunately, I haven't worked with any. I did work with Auntie Jen, but that was indirectly, not too direct like Maureen did. So I haven't really worked with any digital platform.
Okay, thank you. Valerie.
Thank you, Martina. Okay, personally, I've worked with the Tico, and it's an online platform whereby it's an app, and also there is the choice of WhatsApp and even SMSs, whereby it's a platform that provides information on contraception. It also provides information on things to do with okay, family planning basically, and also early pregnancies, and yeah, and even the the facilities that are around you. And for the Tico platform, it is meant for the audience from the age of for young girls from the age of 15 to 24, whereby they can go get services, and after getting the services, they even have an incentive for these young and adolescent girls, so that they can get the Tico miles that they can go and withdraw at a local shop to get things like the sanitary towels, and small things that they can sustain themselves. Thank you so much.
Martina, allow me to add that
Thank you, Valerie. Joanne?
Martina, before Joanne, allow me to add that these platforms are
Joanne?
confidential and reached anonymously. Is it? They protect anonymity and also the privacy of the person itself. And I
I
think
think Joanne
I've
is not
interacted with
around.
one.
Tindali?
I'm around, but Maureen was speaking.
Okay.
Thank you so much.
Okay, share with us the digital platform that you have interacted with.
Yes, please go on.
Okay. Personally, in my initiative, I began this thing. I bought a new line under my name. So when I go for these outreaches in my initiative, what I do, I share that number. I made cards. So after I've spoken to these young ladies, these young boys, I leave them my card. The card, I ask them to text me with their name and the location. So if I was, let's say I had an event in Voi, so these young girls text me, it is so and so from Voi. So immediately I call them, I ask them what is their issue, because basically my initiative provides this safe haven where these young boys and girls can come to me and approach me, because the name Big Sister, you see, it's like a big sister, you know. So I create these safe spaces for these young boys. So when I give them my number, the intention is just for them to reach out and ask me these questions privately, and ask for my help. You see, like somebody can text me, my name is so and so from here. So when I call them, I ask them, do you have an issue? How can I help? Then, since I have worked with the public health office in Tabata County, I know who to approach in this matter. So let's say I have a friend in hospital, it's an easy linkage from this young boy to me, then to me, the public health officer. See, so for me, that's how I do it, and having this webinar today, it's a step closer, and to help me more to get more information on how best I can reach out to these young boys in my community for information. So yeah, that's how I do it myself.
Thank you so much, Joanne. I can see Sindali. Let's move for the another question. Does the
But
ability to access adolescent sexual reproductive health and rights information remotely have any impact on teenage pregnancy? Okay, Valerie, can you start?
Thank you, Martina. Okay, on this, I'll say that yes, it does. And looking at it, we can see that there is timely interventions whereby when this adolescent or a young person is in need of emergency information, they can just easily get it because they can access it anytime and anywhere. And also we can see that there is the anonymity part of it and the privacy, because these platforms have made sure that the information of whoever is using those apps is they are prevented, the rights are actually preserved. And also we can see that there is improved access to information, whereby someone even in Wajir can get this information whenever they just tap into that platform or tap into that website. And Lastly, I can also say that in summary, the remote access of this ASRHR information helps reduce teenage pregnancies by providing privacy, accurate information, and timely access of services, ultimately leading to reproductive health outcomes. Thank you so much.
Thank you, Valerie. Sindoli.
Yeah, okay. I'll say the previous speaker has elaborated much. Maybe just to add, I'll say the ability.
I can't hear you.
It has also made youth have informed choices, whereby a teenage or a young person can make a choice by the information they have, and it will be an informed one because they know what they want and how they want it. Also, access to information has empowered more young people, of which, if we enhance it more digitally, we will be able to help more young people.
We have lost you, Sindoli. I can't hear. Sindoli is lost. We can't hear you, Sindoli. I think
I think
there's network issue to Sindoli.
maybe we can just move on. Akirudi utampatia nafasi.
Yeah. Ni sawa sawa. Miss Figeli, say something. Are you there, Miss Figeli? Okay, Mercy, Mugacha.
Thank you. If I may add something on the accessibility of SRHR information through digital platforms to people who are in rural places or the marginalized
Yeah.
places. While digital access for me is still limited for some AYPs in those areas, mainly because of the socioeconomic status that they are in, the low income, the areas are underserved, and also it's very hard for them to maybe get access to internet, and also the devices are so they're not many, they're limited, the ones that can make them maybe to get into online platforms, ask for these services. And in addition, these places also have limited access to these gadgets. You'll find maybe one device that is not even able to get to online, like it's only one, so it makes it so hard for AYPs in marginalized places to access the information through digital places. That is why the grassroots services should be really strengthened, should be strengthened. And also on the same, there should also be there should also be increase of awareness and knowledge on how maybe to use these digital gadgets, but on the marginalized places. Thank you.
Okay, thank you so much. Another one is Miss Indol, are you there? You are you Comorin, add something. Hello,
Yes,
mnanisikia
definitely.
ama
Yes,
tumepotea?
nakusikia. Ninakusikia. Confirm kama unanisikia kindly.
Nakusikia sahi.
Oh, asante sana.
Yeah, I can
So
hear you now.
just wanted to add in terms of yes, it is working because it has enabled breaking of barriers in chains of receiving those information that we now do not have to depend on maybe a physical gathering to get informed on adolescent sexual reproductive health and right information. And it has also helped in breaking some cultural barriers. You see, there are some cultures which says, oh, girls or boys of a certain age should not hear about this, you know. So you find that when this is online, then it gets into the ears of everyone that can consume it for a change. Then again, I always say we learn as we go. When somebody sees an information, for example, speaking about FGM survivors and everything. So in such some cultures, these girls and later on they feel stigmatized, they feel bad. But again, you get information that shares, hey, this is not right, and girl, it is not your fault. Then you find that again, that was shared online, and these girls esteem is built up, confidence is built up, and they are able to just pick up their life pieces and just stay strong and make really good choices. So again, it also promote a lot of healthy relationship, and with regards to even consent matters. You know, information is shared again and again and again until it gets to this young person who says, I heard somewhere saying, do you know it is your choice to say yes? Do you know you can actually even say no after you've said yes? Do you know you can change your mind? Therefore, this is a young person that is raised very opinionated and knows where to even report sexual violence issues.
I think we have lost Maureen. We can go to the next question because time is also not on our side. It's past 9. Martina, we can go to the next question. Can you hear me?
I can hear
Am
you
I?
now.
Yes, we proceed to the next question because the time now is not on our side. We can do the last question for every participant as we are concluding. Joan, you can hear me? Mercy, you can hear me?
Yes, I can.
Yes, so we'll go to the last question. I think internet is becoming a challenge to most of us. So how do we leverage on the digital adolescent sexual reproductive health and right information platforms? Those that we know, those that we're working with, those that we'd want to work with, so that we can positively mitigate teenage pregnancy among AGYWs in informal areas and disadvantaged backgrounds. So we'll have a round for everybody as we are making our final remarks. Thank you, Martina, for the good leadership and the good moderation. Mas, we can start with you.
Well, thank you.
Something that we should continue doing. I think we should continue leveraging on the already existing platforms that AYPs are getting access or are using to get access to SRHR education. And we did mention some of the chatbots that are being used to ask questions, to consult for services. We continue to promote the mHealth apps when maybe a young person wants to connect to a professional and they want guidance, or maybe they want to access services, they be linked to that healthcare provider. We should also continue curbing the misinformation that is circulating or can circulate, also on cyberbullying, the misinformation or on maybe contraceptives. That will also be nice. And in addition, we should continue to strive for CSC to be part of our curriculum, to be included, so that every adolescent or every teenager, before they come out of high school or they have the information, they are educated, they are sensitized on contraceptives, how pregnancy does occur, on abuse, mental health, every aspect of SRHR, and that will do a lot. We should also try to curb the media influence, the peer pressure thing, and will save a lot of teenagers from being victims of teenage pregnancies. That's all. Thank you. Noli, you're muted. You're muted, Noli.
Sorry,
Thank you so much, John.
technology. Joanne Winchester, how do we leverage on digital SRHR information to positively mitigate teenage pregnancy?
Thank you, Noli. Okay, I think my parting shot will be, as I mentioned earlier, I said something to do with peer-led and youth-led. When these platforms are actually centered for the youth, there is this notion that goes, it was a slogan that was going around, nothing for us without us. So when we are working for the young people and youths, when dealing with teenage pregnancies, we should look at it from the aspect of, I am a youth and I'm speaking to my fellow youth, so peer-led and youth-led. And also, we should also make these platforms incentivized in the sense that, for example, TICO, as I mentioned earlier, there is the incentive whereby this young person can even have the choice of going to get access to a sanitary towel. And also, apart from that, they are getting the contraceptives for those that are sexually active, so that we are curbing these teenage pregnancies. Sorry, my voice was breaking. And lastly, I'll say that combining mobile accessibility, insensitivity, and also community involvement and privacy protection, digital SRHR platforms can significantly reduce teenage pregnancies in the disadvantaged areas. And also they'll be able to serve the vulnerable communities that cannot even have access to these digital platforms. When it comes to mobile apps, they'll have access via SMSs and also even in person, because we have to train them, to train the people that are actually leading these platforms and even in the rural areas. Thank you so much.
Thank you so much. Joanne, you want to add something as we are closing up, winding up?
Yes. I feel we've established that young boys and young girls have access to digital literacy. So I feel we can leverage on local content. Let's say I'm from Taita, I can do maybe different videos expressing sharing information on SRHR in my local language. You see, I feel it can easily penetrate through the young boys and girls. Then we can use our local influencers, our TikTok and everything, we can just collaborate with them just to continue to engage them, to continue sharing more knowledge on SRHR to this young youth, because they tend to listen more to guys their age. So we can leverage on that also, and then we can also easy the laptops that the government was sharing, the laptops, yeah. So we can use such means also with the government, collaborate with the government, and continue making policies that center that continue promoting information SRHR. Also involve our parents. Yeah? Our parents feel that if we can involve more parents on speaking on the digital platforms on SRHR and giving as I put it, giving life examples on how this digital information has helped to reduce teenage pregnancies. That can be a plus. So that's my take. Thank you for listening.
So thank you so much. I'd want to appreciate us for creating time to have this session. I know we started a bit late, and being the first time, we've experienced some technical or technological challenges. And it's my hope and prayer that this is an opportunity we've created. We'll be able to engage more and more so that we empower our members of the community. From myself, on behalf of Kuza Livelihood Improvement Projects, I'd want to say asante sana, together with the Sauti ya Mwambao Media that has given us this platform. We want to appreciate. And until next time, asanteni na tuonane tena. Thank you so much, all of us.
Thank you, Noli, for this. Thank you for this engagement. It was a good one. Thank you.
Thank you so much.
Thank you, Noli.
It was amazing. Thank you, Nodli.
Asanteni, tuko pamoja. Sindoli was a bit locked out. Sindoli, we are saying kwaheri. We know we've had some challenges. Together with Martina, we are saying bye-bye for today. So we appreciate your time, and I hope we'll be able to continue this collaboration so that we can impart our community. Kwa hivyo tukuwe na wakati mwema, sisi sote na usiku mwema. Kwaherini.
Night, everyone.